If you have a cough that lingers and won't go away, you're not alone. Coughing is one of the most common respiratory complaints, accounting for as many as 30 million clinic visits a year. Coughing is the body's natural way to rid itself of different irritants, but if a cough lasts for more than 4 to 8 weeks, it's time for an evaluation. Coughing will usually fall into one of 3 categories. The first category is upper airway cough syndrome. It's often caused by postnasal drainage from hay fever or a sinus infection. The second category is cough variant asthma. This is a dry and non-productive cough. It can be triggered by allergy-causing substances, exercise, and cold weather. The third category is gastroesophageal reflux disease, or GERD. GERD is caused by the contents of your stomach backing up into your esophagus. It is important to note that if you are using an ACE inhibitor or are taking blood pressure medication, your cough may be a side effect of your medication. The best way to find out what is causing your cough is to talk with a doctor. For more information about asthma or to schedule an appointment, visit FamilyAllergy.com.